Thanks for watching On Call for All Kids. Today we'll be talking about the dangers of button batteries. We will discuss why button batteries pose such a danger to kids, what parents should do if they suspect their child has ingested one, and the best way to prevent accidental emergencies. I am joined by Dr. Ebony Hunter. She is an emergency medicine physician here at Johns Hopkins All Children's Hospital. Thanks for joining us, Dr. Hunter.
Thanks, Ashley. It's always great to be here.
Really good topic, and maybe something parents don't always think about. So, what are button batteries, and how common is it that children actually ingest them?
So, button batteries are a common term for lithium batteries. They're also called coin batteries or flat batteries, depending on how you refer to them. They are very common. They're in a lot of household items, watches, toys, gadgets. And because of their appearance of little tiny shiny objects, kids are really attracted to them. And unfortunately, they will put them in their mouths because kids put a lot of things in their mouths. This is quite common that children will ingest button batteries. The incidence of button battery ingestions is approximately 3,500 button battery ingestions per year, and that has increased in the last decade, unfortunately.
And so, what makes it so harmful when they are ingested?
So when button batteries are ingested, they have this alkaline, or better known as a chemical reaction, with anything moist like saliva or skin tissue. And once this reaction starts, it can burn the skin, kind of liquefy the skin in as little as 1 to 2 hours. And it literally will just kind of dissolve the skin. If the button battery is not promptly removed after it is ingested, then unfortunately that reaction can continue because it's a chemical reaction, kind of like a train that's left the station.
What should parents do if they suspect that their child has ingested a button battery?
If there is any concern that a parent or guardian has that a child has ingested a button battery, then they need to promptly bring the child to emergency department because that reaction can be very rapid and very severe. One of the things that you can do if the child is not vomiting and not having any distress and over the age of 12 months is give the child honey. Honey, common household item, helps to kind of neutralize some of that acid process and help prevent as much burning. The button battery will still have to come out. So you still have to bring them to the ER. Don't give the child anything else, such as milk or water. Some people think intuitively, oh, that may help. It'll help it pass, or it'll, help soothe the area. No, it actually does the exact opposite. It speeds up that chemical reaction so that it actually burns the child faster. Also, don't give the child anything to eat because we oftentimes have to take the children to the operating room to get the buttons batteries out. So we don't want them having to be sedated on a full stomach. Don't induce vomiting because again, that can make it worse. So the biggest thing above all is just bring them to the ER.
And what are some of the signs and symptoms if they've ingested one that you all often see?
Oh, this one can be tricky because if it's early on, they can have no symptoms at all. So if you see them with button batteries and one's missing or something's on the floor or they had a shiny something in their mouth, just bring them. Now, if the button battery has been there for some time, then they can have a wide range of symptoms, such as difficulty breathing, or drooling, or chest pain, or stomach pain, vomiting, coughing up blood. It's just, there's a lot of symptoms, and it largely depends on where the battery is stuck, per se.
What can parents do to prevent this from happening altogether?
Some parents are going to hate me for saying this, but just not have them in the house is the best option. They are so common in so many of the things we buy, especially some of the cooler gadgets. So I know that it's not the most reasonable option, but if you can limit how many gadgets you have, and definitely toys. Other things is if you're going to have gadgets with button batteries, keep those out of reach of the child so that they can't get a hold to them. Any extra button batteries need to be locked up, put away, secure, out of the reach of the child. And then educate other people who take care of the child. So, grandparents, friends, babysitters, so they can proof their homes and make sure that they are limiting button batteries and keeping them secure so that anywhere your child goes, they are pretty safe. The people know what to look for.
And Dr. Hunter, I think in talking to some of your colleagues in the emergency department, I remember even birthday cards can have them, and they're the ones that sing. So, also something to think about.
Absolutely.
What else do we need to know about button batteries?
So I know we're talking about ingesting button batteries, but kids are kids and they like to put things in very weird places. So they will put these in their nose or their ears or any orifice that they have. And if you notice like a lot of drainage on one side of the nose or drainage out of the ear and a lot of ear pain and a button battery is missing, again, please bring them to the ER because it can cause the same reaction in any orifice of the body. And we don't want that to happen.
No, we do not. Well, thank you, Dr. Hunter, so much for joining us today. We appreciate it.
You are so welcome. Thanks for having me.
And thank you all for watching. Don't forget, you can also visit our website. It's hopkinsallchildrens.org/newsroom. There you'll find a lot of great topics in pediatric healthcare and other wonderful resources for your family. We'll see you next week.